most employers are getting rid of coverage, cutting back coverage, or asking you to pay more money. They've actually added things to make it better. So that's significant. Remember, benefits for you, not to you. So here's some of the things that pay 100% of the cost. They pay 100% of the cost of the basic life. Epiphany, direct primary care. Who's on direct primary care plan here? That's not free, folks. That's $65 for me, $65 for my wife, $25 for my kid, and $10 for each additional 2 kids. I went to Georgia, so I'm pretty good with math, unlike the Gator folks here. But anyway, I'm too tired, I'm not gonna add it up today. But anyway, that's free, that's covered for you. They're taking care of that. You also have the MAP program. They're doing that at no cost to y'all either, but it's a cost to them. And they're gonna give you the direct cash pay that's gonna offset your costs when you go to a non-DeSoto hospital. So those are big deals. And they've got telemedicine. They also pay the majority cost of the medical insurance. And they got the retirement plan, 1%, a dollar for dollar match up to 3%. That's a big deal. And they're paying over 50% of your cost of coverage. We just heard today the city or one of the county or one of them, they only, a lot of times most people help with the employee only, not on the whole amount. So let's talk about that. So here's an example, and this is where it's really significant. Did Lois tell y'all we're having a 20% rate increase? Anybody? Y'all believe me? Wow. All right, you're smart. You're a lot smarter than anyone else I know. So there's no change. How about a round of applause for Lois and the team, and y'all, and all of y'all.
Yes.
That's the reason, okay? That's the reason. So that's extremely important. So here's kind of where we were in the past. And y'all went down last year in what they would charge, and that's where we are. And then this is really important. Look at what DeSoto is putting on the table for y'all. That's how much this costs behind the scenes. I know you complain. I think, who was it? Somebody said somebody was paying $500 a month just for their employee and spouse.
At another facility.
Yeah, here. So it's a big deal. I know it's money. I know it costs, but compared to others, it's substantial. And if you're on the non-wellness plan, again, no change. And I don't know your name, man, but you're not allowed to answer questions anymore because you took my thumb. I was trying to have fun. No, keep participating, please. All right. Also, you have these biometric screens. We have the wellness plan has certain requirements. This is some of them. Those will come in January, February, and we've been able to, with the data analytics platforms that Lois and them pick, the data, Lois is not seeing this, we're allowed, but the data is, all of these are kept. So we have a baseline last year where you guys are established, which is great, so we can see how you're doing year to year and watch it. Also, if you've been identified, anybody in any of these programs in the room, raise your hand. Nobody, huh?
Hi, Charlie.
Yeah.
Okay. Good experience, bad experience?
All right. It's getting better.
They don't call often, I've heard.
Oh, no, they do.
Oh, yes. I always call at the wrong time.
While I'm here.
Now let's talk about that for a minute. Most employers don't have things like that. This costs DeSoto a lot of money. Free supplies, free peripheral devices that you use. The reason this is here is to help y'all. That's it. Because they're investing money that could be used for other things, but they want to help y'all. Get free, if you're diabetic, free test strips, free supplies. That stuff's expensive, folks. Who's in here and a nurse? All right, 10% of the population of every employer in America is diabetic. And those diabetics that don't comply to meds and don't get the test strips and can't afford to do those things, they end up in the ER. And they end up in the patient. I know, thank you. So that's exactly what we're talking about. So DeSoto is trying to prevent that and try to help everyone. So hopefully it's been a good experience. It's not perfect, but I can tell you there's nobody, there's nobody in Arcadia doing this. And the cool part is they get the information and you go to the direct primary care doctor with Ann over here and Dr. Gross and Dr. Krauss, they're seeing those readouts once a month. So everybody is on the same page. It's integrated, coordinated care. The problem with the healthcare system today is it's all fragmented and siloed off. Now everybody's talking to each other. All right, so let's talk about that for a minute.